When we talk about heart failure, most people imagine dramatic medical emergencies, sharp chest pain, or sudden collapse. Yet in reality, the condition often begins quietly, almost invisibly, weaving itself into daily life disguised as harmless tiredness or the natural result of stress, aging, or a busy routine. In this video, I want to talk you through the subtle early signs that many individuals overlook for months or even years, not because they are careless, but because these symptoms are deceptively ordinary. They feel familiar, like the way your body reacts after a long day or a poor night's sleep. And so the idea that they might be rooted in a weakening heart barely crosses the mind. Understanding these early warning signs is crucial, because heart failure is a condition where time matters enormously, and catching it in its early phase can dramatically change outcomes, quality of life, and the range of treatments that remain effective. When symptoms are recognized early, the heart still has some reserve. Medical therapy can work more efficiently, and the body has not yet adapted in harmful ways that make the disease harder to reverse. One of the first signs that often blends into the background of everyday discomfort is shortness of breath during ordinary exertion, especially when climbing stairs or walking uphill. People tend to blame this on poor fitness, lack of sleep, or simply getting older. But in early heart failure, this breathlessness has a distinct cause. When the pumping power of the heart begins to weaken, even slightly, it cannot push blood forward efficiently, and pressure begins to build up in the vessels of the lungs. These vessels become congested with excess fluid, reducing the amount of oxygen that can efficiently pass into the bloodstream. As a result, even modest activity begins to feel like a much heavier effort. You may notice that climbing a flight of stairs that once felt easy now forces you to pause at the top, or that carrying groceries leaves you more winded than usual. The key distinction is progression. This breathlessness gradually becomes more noticeable over weeks or months. If you observe that previously manageable tasks feel harder, and that this change is persistent rather than temporary, it is essential to consult a cardiologist, especially if you also experience a sense of chest tightness, or if the breathlessness appears suddenly without any clear explanation. Another subtle sign that often masquerades as everyday fatigue is swelling in the legs or ankles that becomes more noticeable toward the end of the day. Many people mistake this swelling for the result of sitting too long or standing at work for extended hours. But in early heart failure, the swelling has a specific physiological cause. When the heart cannot pump effectively, blood returning from the lower body begins to pool in the veins, and pressure forces fluid out of the bloodstream into surrounding tissues. This fluid accumulates slowly throughout the day, making the ankles appear puffy by evening, sometimes leaving a noticeable indentation if you press a finger into the swollen area. People may shrug this off, thinking they simply need more rest or better shoes, yet persistent swelling, particularly if it is symmetrical in both legs, should never be ignored. It signals that the heart is struggling to keep blood circulating efficiently, and that the kidneys are also receiving mixed signals due to poor blood flow, which further promotes fluid retention. If you find that this swelling occurs daily, increases over time, or is accompanied by weight gain that cannot be explained by diet, this is a serious sign that warrants an urgent evaluation by a cardiologist. Sleep is another window into the early stages of heart failure, and one of the most telling symptoms appears at night. This symptom is known as nocturnal shortness of breath, and many people misinterpret it as anxiety, a nightmare, or the feeling of waking up startled from a deep sleep. In reality, what happens is this. When you lie down, gravity shifts fluid from the lower part of the body back into the central circulation. In a healthy person, the heart adapts easily, but in someone with early heart failure, the sudden increase in blood returning to the chest overwhelms the weakened pump, pushing excess fluid into the lungs. This causes a sensation of struggling to breathe, forcing the person to sit up, sometimes gasping for air. People often describe it as a frightening but rare occurrence, something they dismiss as an isolated event. However, even a single episode of nighttime breathlessness should raise concern, and repeated episodes must be taken seriously. If you notice you need extra pillows to sleep comfortably, or if you wake up coughing or feeling like you cannot draw a deep breath unless you sit upright, this is a strong sign that your heart is not managing nighttime circulation properly, and you should see a cardiologist promptly. Another early sign that people attribute to stress, caffeine, or lack of rest is a sensation of a fast or irregular heartbeat. This can feel like fluttering in the chest, a racing sensation, or skipped beats. Many people experience palpitations occasionally and assume they are harmless, but in early heart failure, the underlying cause is different. The heart, sensing that it cannot pump enough blood with each beat, tries to compensate by beating faster or irregularly in an attempt to maintain adequate circulation. Over time, this becomes counterproductive because the rapid rhythm reduces the time the heart has to fill between beats, further decreasing its efficiency. If you notice your heart pounding even when you are at rest, or if you feel irregular beats that occur frequently, or come with dizziness or shortness of breath, it is important to seek medical guidance. Persistent palpitations, especially those accompanied by other symptoms like fatigue or swelling, are not something to ignore. Fatigue itself is one of the most misleading early signs of heart failure because its onset is so gradual. Almost everyone experiences fatigue at some point due to work, lack of sleep, stress, or illness, so it rarely raises concern. Yet heart failure-related fatigue has specific characteristics. It is not the type of tiredness that goes away after rest or sleep. Rather, it feels disproportionate to your level of activity. People describe it as a heaviness of the body, a sense that daily tasks require more effort, or an underlying physical exhaustion that persists throughout the day. This fatigue occurs because the weakened heart cannot deliver enough oxygen-rich blood to the muscles and organs, forcing the body to prioritize essential systems at the expense of physical stamina. The muscles tire quickly, concentration may suffer, and the person may start avoiding activities they once enjoyed simply because they feel too worn out. If fatigue becomes a persistent, unexplained presence in your life, and especially if it coincides with other symptoms mentioned earlier, it is time to get a cardiovascular evaluation. As the early progression of heart failure continues, another subtle but common symptom appears, a persistent cough or a light wheeze that people frequently mistake for seasonal allergies, a lingering cold or irritation from dry air. This cough often becomes more pronounced when lying down and may be accompanied by a slight frothy sensation in the throat. Though in early stages, it is usually mild enough that people dismiss it as insignificant. The root cause of this symptom lies in fluid buildup in the lungs. When the left side of the heart struggles to pump efficiently, blood returning from the lungs cannot be cleared as rapidly as it should be, and over time, tiny amounts of fluid seep into the airways. Although this is not enough to create dramatic respiratory distress, it is sufficient to trigger a reflex cough or a soft wheeze, especially during rest when the redistribution of fluid becomes more pronounced. If you find that you develop a mysterious cough that persists for weeks, especially if it worsens when lying down or does not respond to typical medications, it is important to consider the possibility that your heart may be under strain. Consulting a cardiologist in such cases is essential because ignoring this symptom may allow the underlying condition to progress unchecked. A more unexpected early sign is a subtle decrease in appetite or a sensation of early fullness during meals. This is another symptom that hides easily in daily life, often dismissed as a result of stress, digestive changes, or an irregular eating schedule. However, in the context of early heart failure, this symptom has a clear physiological explanation. As the heart weakens, fluid can accumulate in the abdominal organs, including the liver and gastrointestinal tract, causing mild congestion that interferes with digestion. This congestion can create a sense of pressure or fullness long before the stomach is physically full, leading to reduced food intake and sometimes unintended weight loss. Additionally, reduced blood flow to the digestive system slows metabolism and can create subtle nausea or discomfort after eating. If you notice that your appetite has declined without any clear reason, or that you frequently feel full after only a few bites, this is not something to ignore. A cardiologist can assess whether abdominal congestion is developing and whether early heart failure may be interfering with gastrointestinal function. Another early sign that goes unnoticed is the increased need to urinate at night. People often blame this on drinking too much water before bed, or assume it is a natural part of aging. But in early heart failure, it indicates a delicate shift in the body's fluid balance. During the day, when a weakened heart struggles to pump effectively, fluid tends to pool in the legs and lower extremities. When you lie down at night, this fluid is reabsorbed into the bloodstream and filtered out by the kidneys, resulting in increased urine production. The pattern becomes particularly concerning if you awaken multiple times during the night to urinate, especially if this is a new development. Over time, this constant nighttime awakening disrupts sleep quality, which can worsen daytime fatigue and create a cycle of exhaustion that masks the underlying cardiovascular problem. If you find that nighttime urination has increased without any clear change in your habits or diet, you should consider a cardiovascular evaluation, especially if other symptoms of fluid retention are present. At the same time, many individuals with early heart failure begin to notice difficulty concentrating or subtle memory lapses, often assuming these issues stem from stress, aging, or lack of sleep. Yet the brain is highly sensitive to changes in blood flow and oxygen supply. When the heart's pumping ability begins to decline, even slightly, the brain receives less oxygenated blood than it needs to function optimally. This may manifest as mental fog, difficulty focusing on tasks, slowed thinking, or moments of forgetfulness that feel uncharacteristic. These cognitive changes are often subtle at first, developing gradually and blending into the background of everyday life. However, they are significant because they reflect the broader impact that reduced cardiac output has on the body. If cognitive changes persist, and especially if they coincide with physical symptoms like fatigue, breathlessness, or palpitations, it is important to seek medical advice. A cardiologist can evaluate whether decreased blood flow from early heart failure might be contributing to these cognitive symptoms. Another quiet but telling sign is a noticeable decrease in physical endurance. People often attribute this to aging, a busy schedule, or a change in fitness habits, believing that they are simply out of shape. But in early heart failure, the decline in endurance is often disproportionate to lifestyle changes. For instance, you may find that a familiar walking route leaves you more tired than usual, or that activities you once completed effortlessly now require breaks. This decline occurs because the muscles are not receiving the oxygenated blood they need to sustain activity, causing them to fatigue more quickly. In early stages, the change may feel subtle, creeping slowly into daily routines. Many individuals try to compensate by adjusting their pace or reducing their level of activity, inadvertently masking the underlying issue. If you notice a persistent reduction in your ability to engage in physical tasks that you previously handled with ease, especially if this occurs progressively over several weeks or months, it is important to consider that your heart might be under strain. A cardiologist can perform tests to evaluate exercise tolerance and detect early signs of heart dysfunction. Another frequently overlooked early symptom is mild dizziness or lightheadedness, especially upon standing up or during sudden movement. Many people assume this is caused by dehydration, skipped meals, or low blood pressure. And while these can indeed contribute to dizziness, early heart failure can also be a significant underlying cause. As the heart's pumping efficiency declines, blood flow to the brain may become momentarily insufficient during changes in posture or increased activity. This can produce a brief but noticeable sensation of imbalance or faintness. In some cases, the dizziness is accompanied by blurred vision or a feeling of warmth spreading through the body. While occasional mild dizziness is common and not necessarily alarming, persistent or worsening episodes should not be ignored. If dizziness occurs frequently, especially if it is accompanied by palpitations, breathlessness, or fatigue, it is a sign that the cardiovascular system may be struggling to maintain stable circulation under varying conditions. Seeking evaluation from a cardiologist can help determine whether early heart dysfunction is contributing to these episodes. There is also the subtle experience of chest discomfort that does not resemble the classic image of chest pain. Instead of sharp or crushing pain, early heart failure may produce sensations of tightness, heaviness, or mild pressure in the chest, particularly during physical exertion or emotional stress. These sensations often fade quickly when the activity stops, leading people to dismiss them as muscle strain or anxiety. However, these symptoms can reflect the fact that the heart muscle itself is not receiving enough oxygen-rich blood. As early heart failure progresses, the heart struggles to meet the body's demands during exertion, and this can create a mild but distinct discomfort. If you experience recurring episodes of chest tightness or pressure that appear during stress or activity and resolve with rest, it is essential to take this seriously. While it may not feel dramatic, it is a sign that your heart is working harder than it should, and a cardiologist can determine whether these symptoms indicate early structural or functional changes in the heart. As we look deeper into these early manifestations, it becomes increasingly clear how easily each symptom blends into normal life. People rarely pause to question why they suddenly need more rest between tasks, or why once effortless activities now leave them winded. This quiet shift in the body's capabilities often unfolds slowly, almost imperceptibly, creating a deceptive illusion of normalcy. But the body is an exceptionally skilled communicator, and these subtle hints are its way of signaling that the heart, one of the most hard-working organs, is no longer performing with its usual precision. Each of these early signs forms part of a larger narrative that must be understood as a whole, rather than in isolated fragments. A single symptom might not reveal the full picture, but several occurring together weave a pattern that should never be ignored.